question. Okay, 32-year-old woman who is gravida 1 para 0. Okay, okay. So they're asking which of the following statements best describes the congenital defect in the fetus. Do any of you know what exactly this defect is? It's a neural tube defect, but can any one of you name which one it is? No? Okay, it's fine. Okay, so the answer is option D. Yeah, it is a failure of the caudal neuropore to close. Yeah, correct. It's myelomeningocele. Yeah, someone answered meningocele also. That's, yeah, it's almost, I mean, it's very similar. The only difference being that the spinal cord is involved in myelomeningocele. But essentially, the ultrasound reveals widening of the lumbosacral spine ossification centers and the presence of a sac in proximity to the lumbosacral defect. So this itself points towards a diagnosis of a myelomeningocele. Apart from that, the other findings in the in the mom's serum levels, such as a low level of folate, in addition to an increased alpha-fetoprotein, suggests a neural tube defect. So there's just something. If alpha-fetoprotein level is increased, automatically think of neural tube defect. If it is reduced, think of Down syndrome. It's not the only one. It can occur even in the other trisomies, but just think of Down syndrome as one of the differential diagnoses for that. Okay. So the first option, which is abnormal development of the caudal eminence, this causes what is known as a tethered spinal cord syndrome. Essentially, the underlying defect lies in the name. It's tethered spinal cord. So the phylum terminal portion of the spinal cord will essentially be attached to an inelastic substance. So there's a stretch-induced defect in the spinal cord. So that's just what they're signifying with this. The second option is a persistence of the anterior accessory neurenteric canal. This is the canal that is normally responsible for connecting the ectoderm and endoderm in the developing embryo. In this case, if there is a persistence of the anterior portion of this, it causes certain neurenteric cysts, or it can cause a defect in the development of a notochord and can cause what is known as a split notochord. One important thing to note, which will come in the subsequent question, but I'll just mention it here. If there is a persistence of the intermediate portion of the accessory neurenteric canal, think of Klippel-Feil syndrome. Okay, so I will explain that later, but I've also mentioned that in the previous class as to what the triad of that syndrome is, but this is just an additional information. Okay, failure of the rostral neuropore to close, very similar to the caudal neuropore, except this is directed rostrally. For those of you that don't know what rostral means, it just means something that's direct. As you may have heard, towards the nose, signifying that we describe craniocaudal growth, or we describe cephalocaudal spread in the case of rashes. For example, in measles and rubella, we describe the maculopapular rash as being cephalocaudal in spread, since it starts on the face, then spreads to the trunks and extremities. But in this case, rostral neuropore, we're talking about brain involvement. So essentially, they're referring to an encephalocele, but it could also be an anencephaly. The difference between the two is that in the case of an encephalocele, there is no overlying skin defect, whereas in the case of anencephaly, there is an overlying skin defect, as a result of which the calvarium and the skin overlying will be absent. Okay, so there's this differentiating feature. Okay, option E is failure of the mesenchymal cells to form a neural rod. This sort is a very vague way to describe a bunch of pathologies that actually come under this. For example, like I mentioned in the first option, the tethered spinal cord syndrome, that comes under this. Another one is sacrococcygeal teratoma, which, as you may know, is one of the most common tumors seen in at the time of birth, which is, I don't want to go too much into that, but just a tumor present, as the name implies, in the sacrococcygeal region. Okay, and it's a teratoma, so you can imagine it involving all the three germ layers. Okay.
Thanks for watching. Please give a thumbs up and subscribe for more.